Share your perspective.
Only on Cape Talk.
33 minutes after 9 o'clock. My name is Saskia in for Mr. Clarence Ford, and I love coming in on a Friday because, of course, we chat to the naked scientist on a Friday. Dr. Chris Smith joins us, consultant virologist, and, of course, answering all of your weird and wacky and wonderful science-related questions. Good morning, good Dr. Chris Smith.
Oh, hi, Saskia. How are you doing? All right?
I'm very well. Always very excited to speak to you. I believe, though, that before we get to today, you had some homework to do.
Yeah, I did, and I have to say, it was a really interesting question that Zuki sent in last week, and it was about a muscle in the arm which is absent in a proportion of the population. And I had to admit, I'd always thought this was apocryphal, this story, that people always say, they use weird words like double jointed, and that's rubbish. That just doesn't exist. There are people with hypermobile joints. But then alongside that, people had said there are muscles that are missing in some people. And I always thought that was in the same camp as double jointedness and other bizarre things that don't exist. And in fact, I was completely wrong. And I went and had a good bit of a read around. And what Zuki was referring to, I think, was palmaris longus, which is one muscle in the wrist, which is quite a long muscle in the wrist. The best way to find it, if you take your thumb and your small finger with your palm facing upwards, bring your thumb and small finger together in a pinch grip between those two, and twist your hand, your palm up towards the ceiling. If you look in your wrist, you'll see there's a prominent tendon right in the middle.
Yes.
If you've got that, you have palmaris longus. But about 15% of the people doing this or listening to this program will not see that bulge in their wrist because they don't have that muscle and tendon. And in other words, it's disappearing from the population. It doesn't seem to make a very big contribution to hand movement. In fact, people going back to the 1950s have looked at grip strength and the contribution that this muscle does or doesn't make, and they don't find any contribution to grip strength in humans. Other animals, though, use it a lot, and generally it's animals that climb around in trees. So in other words, as our evolution took us out of trees into a more upright, taller, walking on two legs bipedal affect, we lost the ability to do what we do in trees, and therefore we lost our reliance on this muscle. So it is slowly being weeded out from the population. So at the moment, about 15% of people don't have it. Left to its own devices, when you've got something that does not contribute meaningfully to daily life, eventually it does disappear because it confers no advantage. Therefore, if you happen to lose it, you confer no disadvantage and you pass that trait on to your children. And it's biology's way of honing and avoiding wastage so that we only have what is the perfect way of operating. That's right. So at the moment, about 15% of people won't see that bulge in their forearm. But it's very useful for surgeons because if they want to borrow a muscle or a bit of tendon or both, they go for that one because it's the one you can afford to lose if you've got it, because you're not going to suffer any ill effects through not having it. So they move it to other places in the body. You take the blood supply, take the tendon, and you can use it in parts of the body that have been injured or need repair, for example.
Fantastic. That is fascinating. That is absolutely fascinating. So there's going to be about 15% of us that's walking around going, I'm more highly evolved than the others.
You could look at it that way, yeah.
All right. We have got a question for you that's come in from Keith. Keith says, can bats and moles see? Because of the sayings, as blind as a bat. And in Afrikaans, we've got a saying, I don't know if you're familiar, so blind soos 'n mol. So as blind as a mole. Can bats and moles not see?
This saying is, again, a bit of a misnomer, actually. And it really should be as blind as a rat rather than blind as a bat, because some bats have excellent vision, some less good vision, but they definitely outperform many rodents in terms of their visual acuity and ability. It's mainly because bats fly around at night and rely on their sonar sense that vision for them is a lower priority, but they definitely can see. Moles are pretty poor performers in the visual world because they really do inhabit a very, very dark world that is chiefly dominated by vibration. They have very long whiskers and they're very sensitive to vibrations and hearing sounds, and so moles rely on those senses much more. But bats do see, although they do put much more emphasis on their sonar sense than they do on their visual one, but they probably will outperform a rat.
Very interesting. It's interesting how the rats then find our houses and our homes and our things. They obviously have to have something else that's very highly
Amazing
developed in
noses.
order.
If you look at a rat's nose or a mouse nose, and you look at what it's connected to, the part of the brain in a rat and a mouse that does smell sense is very, very big in comparison to the rest of the brain. It's a bit like a dog. A dog brain is basically a nose with a bit of brain attached to it. Dogs are massively dominated by their smell sense. Well, rats and mice are very, very similar, relatively speaking. The proportion of the brain that is down to smelling, very, very big. And also the part of the brain that decodes what comes in through their whiskers. So again, like the moles, because they live in small spaces, creep through small spaces, they have very long, fine whiskers. Those whiskers are very vibration sensitive, and they connect onto specific, they're called barrel fields in the sensory cortex in the brain. Each whisker has its own bit of brain territory that decodes what that whisker is telling the animal. So they're very, very good at building effectively a three-dimensional view of the world around them through what their whiskers tell them rather than their eyes.
Incredible, incredible. All right, so we've got a question in here from Patel, which has got to do with an enlarged prostate that he had. He says, "Good morning, Saskia and Dr. Chris. I had an operation for an enlarged prostate. After the operation, I noticed that I could not ejaculate and read up that after such an operation, your sperm actually takes an alternative channel inside your body. Can this process be reversed, maybe with medical surgery or using medicine, eating specific foods, or is it reversible in order to get the ejaculation pathway happening as it did before?"
Depends what's been done here. In most men, the prostate gland, which sits around the neck of the bladder, does continue to grow and enlarge through life. We have male hormones, testosterone, that seems to drive this process of increasing cell number, and it's called benign prostatic hyperplasia. A hyperplasia means more cells. Now, this can affect a part of the prostate that wraps around the pipe that comes out of the bladder to let you go to the wee. And this means it can apply pressure to that pipe and eventually sufficient pressure that the pipe pinches off, and it makes it much harder to get the bladder to empty completely. When that starts to happen, people tend to get the problem of waking up in the night for a wee, multiple times a night, not sleeping properly, and this continuous, I don't feel like I've completely emptied my bladder, I need the wee again. And the treatment is a resection of part, or in some cases all of the prostate. Usually they just take out the bit which is causing the obstruction or occluding the water pipe, and that makes the symptoms better. I'm not entirely sure why they would have done a more radical course in this case. I think if you can tell me, maybe you'd like to email me a little bit more information, because rather than speculate wildly, and do guesstimation, it would be better if he can email me. It's chris@thenakedscientist.com. Maybe there are a few more details he could tell me, and then I can find out exactly what they've done and why they've done it, and then I can explain why they're getting the symptom that they are.
Okay, we'll get Patel your email address and make sure that he mails you. Then we have got a voice note from Keith.
Morning, a nice question for the doctor. Dupuytren, or Claus disease, or Viking's disease as they refer to it, is there any cure for it? And where is it derived from?
This is Dupuytren's contracture. And you can recognise this because if you put your hand out in front of you as though you were going to hold a gun, in people who have Dupuytren's contracture, the small finger and the index finger next to it, the ring finger next to it, bend or curve round like a trigger, and they can't be straightened. And it gets worse and worse and worse until you end up with a hand that's permanently like you want to make your two top fingers into a gun with your thumb pointing upwards.
Pew, pew, pew.
And it's called Dupuytren's contracture, and it's because of fascial or palmar fascial thickening. You get fibrous tissue around the tendons of those two fingers, and it causes the fingers to catch and to trigger in the tendon sheaths, and the thick fibrous tissue then stops the fingers extending. And the answer is it can be fixed, and it can be fixed fairly easily. And it's called a fasciectomy. So a surgeon, you need a good surgeon who knows about hands. They go in and they excise the thickened fascial tissue, the fibrous tissue, and release the tendons, and that enables the fingers to straighten. And there's a range of disease associations. Most of these cases are what we call idiopathic. They just crop up in some people. But there's also an association with diabetes. So people who have type 2 diabetes may get this. But yes, there is a surgical intervention that can be quite successful to give people relief.
We're chatting to the Naked Scientist, Dr. Chris Smith. I do believe we have Ron from Lakeside on the line for a question for Dr. Chris. Good morning, Ron.
Good morning. Good morning to both of you, Dr. Smith. My question concerns long COVID. Somebody very near and dear to me got long COVID in 2019, and she's been suffering ever since. There's no change, affected every part of her body. And I was wondering, seeing that you are a virologist and you're probably on top of this, is there any consensus on what exactly happens when a COVID virus invades your body? Because there seems to be a lot of disagreement. The one story I heard was about microclotting in the capillaries, which would affect any tissue in the body, of course. But nothing has happened. All she got from him was loads and loads of anti-clotting mechanism, which, of course, has its own disadvantages. So let's hear if there's anything new from you, please.
Sure. And the answer is that we do not know or agree what long COVID is. The one thing we do agree on is that this is not one condition. What we're calling long COVID is almost certainly an umbrella term that embraces a whole range of different diseases, conditions and manifestations united by the common fact that a person has caught, in this case, the coronavirus that causes COVID, but the outcomes, the mechanisms of those different outcomes are probably all different. So we're talking about a raft of different syndromes and a raft of different diseases and presentations, and therefore a raft of different possible outcomes. They range from damage done acutely at the time of the infection because the virus does some damage, and there are some people who've got dreadful lung damage because the virus caused acute injury to the lungs and they never completely recovered. There are some people where at the time of the infection the virus damaged brain tissue, heart tissue, other parts of the nervous system, and they've never really recovered. And there are some people who've developed post-infectious inflammatory syndromes where you end up with almost like a smouldering immune response which continues inexorably to do damage to tissue, even though the virus that caused that to start has now gone. There are other people who possibly develop chronic infection with the coronavirus where they never completely eliminate the virus in their body. They may have a reservoir somewhere. And there are people who we have done endoscopies, looked with a telescope into the intestine, and you can recover virus particles in these people from way after the acute infection, arguing that it might be lurking in some places in the body without the immune system being able to completely kick it out. And perhaps from that site, it's driving an inflammatory response inexorably. So we don't know exactly what long COVID is. We don't know exactly, therefore, what the best way to manage all these different conditions are because we don't know what they all are yet. We also don't know why some people are susceptible and whether coronavirus infection is the special cause or whether if we'd seen the same person catch another horrible virus infection like a pandemic strain of flu, the flu virus would have done the same thing and it's them rather than the virus. Possibly both. So at the moment, we just don't know, but we're following up many, many people in many, many countries in order to try to learn more about it. The bottom line is, at the time of acute infection, maybe as many as 15% of people get some kind of post-viral sequelae. By about a year or two, this has slipped into single figures, and most people do get better. But there are some, and I've got some friends who have very profound inflammatory states that seem to have occurred in the aftermath of catching the new coronavirus, and they haven't seen that much improvement. So I think the answer is it's a spectrum, and there are some that are going to be absolutely fine. That's going to be the majority, but there are some in a long tail with a long COVID that may not get much better.
Dr. Smith, and there's no consensus even just in terms of symptomatically what helps, like so treating, looking at gut health or looking at boosting your immune system. That would just be generally something that people could look at if they are sufferers.
Usually, if you have a disease, that disease has a mechanism. And once you understand how the disease occurs and what drives it, you can then work out how to treat it. Well, if you have diseases which are a range of different conditions, a range of different mechanisms, and therefore a range of different drivers, intervening with one intervention is not going to treat all of them. So it's a horses for courses thing. You've got to manage the different diseases in different ways for different people. But at the moment, we don't know enough in order to say this is the right way to manage this for you.
Got you. We're talking to the naked scientist, Dr. Chris Smith, consultant virologist. We move now to a question of a different kind. What are blue bottles exactly, and why do they have a trailing sting? This comes in from Peter, who says currently there are thousands of blue bottles on Fish Beach here in the Cape.
I thought he was going to refer to the fly known as the blue bottle, which are the big meat flies which come down and find carrion and lay their eggs in it. And they do it by smelling you out. The blue bottle that he's referring to, we also call the Portuguese man o' war. And I'm very privileged to say I had a nice sting from one of those. Very, very painful.
Oh.
I won't be repeating the experience. It happened to me in Florida, in America. I'd actually gone to watch the space shuttle. Back in the space shuttle era, Discovery was going to take off, and I went down towards Cape Canaveral to watch the shuttle launch, and they cancelled it at the last minute because they're very, very safety conscious, of course. So I thought, what am I going to do with the day? I'll go on the beach. And there'd been a nice storm overnight out in the Caribbean, and presumably it had minced up some Portuguese men of war, blue bottle jellyfish, and there I was swimming around in the sea, and next thing I know, it was like 1,000,000 volts of electricity up my forearm. And my brother, he was more embarrassing. He got stung in the groin area.
Oh my gosh, that must have been so painful.
And it was pretty painful. But we got out of the sea and thought, well, that was a bit unpleasant. And it was when I looked at my hand, my arm, it looked like someone had taken a bramble or a thorn bush and basically scraped it many, many times sideways across my arm. You could see where the tentacles had brushed across the arm, and then on the tentacles are these things called nematocysts. They're little kind of jellyfish hypodermics, and as soon as they touch or sense contact with a surface, they discharge and they fire these little spears into the skin, and they discharge the venom, and that gives you the pain and then the inflammation. And that's why you have all these little red dots, because it's actually a toxin which will cause a bit of tissue necrosis and inflammation. You get these red dots. Anyway, it hurt for a day or so, and then it went away. And I thought, well, that's nice. I can now put that one down to experience. The weird thing was exactly a week to the day after it happened, it all came back. Only this time, instead of being painful, it was ferociously itchy. And I think it was probably an immune response. I think probably there was toxin and other proteins from the jellyfish, and possibly even undischarged nematocysts still there. And it takes time to build an immune response. And so in the week or two after it happened, that's enough time to start to build an immune response to the jellyfish protein that I would never have seen before. And I suspect that then triggered an allergic response, and the whole thing swelled up and was intensely itchy, like you've never had before, and you just want to scratch it the whole time. And that lasted a few days. That was even more unpleasant, really, than being stung, if I'm being perfectly honest. But they're amazing creatures, aren't they, these things, these blue bottles? They're actually a community of organisms. They're not one animal. They're actually a community of cells that live together. They have this bubble that floats on the sea surface with a sail, which is this strip of tissue sticking off the top, and they trail these long tentacles behind them. That's for defence and also prey capture. And an amazing fact I learned about 20 years ago is that about half the population of these things have the sail pointing right to left, and the other half of the population have the sail pointing left to right. Now, anyone who's a sailor knows that when you're on a starboard tack and you've got the wind coming over the starboard side of the boat, that's when you're going to sail in one direction. If you're on a port tack and the wind is coming over the port side, you're going to sail in the opposite direction, and you'd have your sail set on the opposite side of the boat accordingly. So if you are a blue bottle / Portuguese man of war, you have a sail and an onshore wind, half the population are going to get blown on the beach. but half the population are going to go out to sea. So it's quite a clever way of meaning you don't all blow up the shore and destroy your population. Only half the
Right.
population do. But they're part of life's rich tapestry. Don't stand on them. They can sting you even when they're on the beach, and you will
yes.
get very painful feet, and it will itch to buggery in the days afterwards. So try and avoid that.
That's a lovely word, buggery. All right, we've got another question in here, actually a follow-up one from Zuki, saying, thank you so much for the homework feedback. Is there any chance that there are other mussels that may be lost in future generations? Of course, if you've just tuned in, Zuki asked that lovely question about the muscle in our forearm that 15% of us don't have. Are there any others?
Yes, there are. We don't generally move our ears around very much, but just whistle for your dog and watch the response of his or her ears, and you'll see exactly the importance of having ears that can move. We do still have the muscles. They are still wired up to the nervous system, and you can demonstrate actually in yourself. If you, some people can move their ears a bit, but if you put electrodes over the skin around the pinner, the bit of your ear that sticks out from the side of your head, and you make noises, you can see electrical discharges happening in the territory of these muscles. So a human, even though they're not consciously moving their ears or seeing their ears move, the muscle vestiges that are there are still responding in the same way as they would if your dog heard that sound and tried to twist its ears to get the sound tuned in to where it's coming from. Those still exist. Some people can still control them better than others. So that's another example of a muscle which is slowly disappearing because we don't use it.
Fascinating. We've got a question in from Marty. Oh, this is a complex one. How can we prevent food to be contaminated by microplastics?
Really difficult, Marty, and this is becoming a real worry for scientists because it's now just over 20 years since the word microplastics got invented by Richard Thompson, who's a marine biologist down at Plymouth University. And we actually did a really long interview, what we call a Titans of Science episode of The Naked Scientist with Richard, who's now a fellow of the Royal Society, really prominent scientist, on the anniversary of having coined the phrase microplastic and how he made the discovery and how pervasive this has since become. So if you look up the Naked Scientist podcast and look at microplastics, you can actually hear the man who discovered this whole thing talking about where it's come from too. And his really poignant thing he said to me was that we don't know microplastics are everywhere, but everywhere we look, we find them.
We find them. Oh,
They're in
Lord.
the air, they're in the sea. They're in the land. And when water ends up in the sea, it washes them into the sea. The things that are in the sea pick them up, and that means filter feeders like mussels and whelks, shellfish, fish and other animals that eat those things, eat them and pick them up, and things that pick up the fish pick them up, so they can end up in us. And when we look in us, we find them in many, many tissues. We find them in the walls of diseased arteries. We find them in brains associated with Alzheimer change, so they might be doing that. We even find them in placentas of developing babies. So they're going in through the bloodstream and ending up everywhere. So we are all being exposed. They're ubiquitous. And there was even a study earlier this year looking at bottles of mineral water taken off the shelf and finding thousands of microplastic particles in a pristine bottle of mineral water. So the answer is it's very, very difficult to not be exposed to these things. So for me to say do this, this and this and be prescriptive, it would be almost certainly misleading. The answer is that they are everywhere. We do not yet know what the risk is, if any, but we're doing a huge natural experiment and we're going to find out, sure as hell no, in the next 10, 15 years, I'd say.
Gosh. All right. Last question in from Roy. Must every dog bite result in a trip to a doctor for an anti-rabies injection?
It depends where you live. And the answer is there are some high-risk geographies and some lower or no-risk geographies. Let me explain. The African continent is a high-risk area because most feral animals have a high likelihood that they will have run into rabies because it's endemic. The UK does not have rabies in mammals like dogs, but it does have a bat rabies virus. So if you ran into a dog in the UK and you got bitten, you'd be worried about infection from, say, a microorganism like a bacterial infection, but you wouldn't worry about rabies because unless that dog has lived in another territory where rabies is endemic, it hasn't got rabies. Get bitten by a bat, different story. In Africa, if I had any kind of run-in with any kind of wildlife, like a dog or a cat, and I didn't know the provenance of that dog, it was vaccinated beforehand, so it's a feral dog, for example, especially if I was out in the bush or something, then I would be very worried indeed, and we never take risks with rabies. So you'd immediately seek help, and the treatment for rabies is you get some immunoglobulin, which are antibodies against rabies, which you inject into the site where the wound happened, and then you also give some into the muscle. This gives you protection in the short term, while the vaccine that you also then get as a series of shots over the next month, that kicks in to drive an immune response, because unprophylaxed, untreated rabies, with very, very few exceptions, is universally fatal. So we never take risks with rabies.
Dr. Chris Smith, thank you so much. It's always fascinating. That's The Naked Scientist. And of course, he'll be back again with us next week. Same place, same time.